Welcome, thanks for joining the PPI breakout room. My name's Aoife Cahill and I'm Programme Manager for investigator-led grants and any of our PPI initiatives. And my colleague Chiara is here with me today and she looks after our PPI initiatives as well. So before we get started, I just wanted to say that this is being recorded. If people want to keep their cameras off, that's okay. While it's being recorded, and if you didn't want your name to be seen, you can remove it as well. But I mean, it would be lovely if people kept their cameras on, but just wanted to let you know that up front. And really, the idea of the breakout room is to have an open discussion on PPI. It's meant to be an opportunity to ask any questions that you might have on PPI, and really where we can help in your learning around PPI. So if you would like to ask a question, I mean, I don't think we're going to have a massive number. You can either put up the virtual hand, or you can write a question in the chat box, and Chiara will be keeping an eye on that. So we have a few more people.
Popping in.
Joining us. I'll just wait. Is that everybody? Chiara?
At the moment, yes. So we have 9
yeah,
people.
Just for those who joined us, just to say, if you did want to leave your camera on, that's great. But I just want to let you know that this is being recorded. So if you didn't want to be seen on camera, then you can obviously feel free to turn your camera off and remove your name if you want to do that. And just for the people who've just joined us, the idea of this breakout room is it's an open discussion and an opportunity to ask any questions that you may have on the topic PPI. Just public patient and carer involvement, but I will say PPI for the duration of this breakout room. So I'll get started. I was going to start by just asking if there was anything in particular people wanted to focus on. We can do that, or we can kind of have a more general discussion. So if there was any area of PPI that somebody wanted to kind of jump in, we can certainly do that. Caroline, do you have a question?
Sorry, Claire has her hand up, Aoife.
Oh, Claire. Claire?
Yes.
Hi, Aoife.
Hi, Claire.
Hi, how are you?
Good.
In my experience within research in the groups that I've worked in, PPI hasn't been at the forefront. And being an early career researcher, what advice would you have for implementing and bringing PPI into a group that currently doesn't implement it, I suppose?
Yeah, I think you need to think about, I guess, all parts of the research cycle and what makes sense for what you're doing.
Yeah.
So obviously the type of research you're doing would come into it. And then it's really, I guess it's really to try to get started somewhere. If it's a group that have never done PPI, there might be they might be interested. They mightn't really.
Yeah.
There could be resistance. They mightn't know understand or even appreciate that it could benefit their research. So, it's really to get started. I mean, anyone who I have spoken to that has brought PPI into their research has enriched their research and enriched their experience. So I think it's to try to get started and probably at small steps. So it could be even just looking at the relevance of your research question and seeing if you connect in to public or patients. I mean, you're not going to, you wouldn't expect to suddenly bring it into every part of the research cycle.
Yeah, great, thank you.
Thanks, Claire. Aoife, we have Jennifer who has a question as well.
Hi, yes.
Hi, Jennifer.
I'm a health workforce researcher, and I often struggle with the PPI question because I always seem to get the answer wrong. Because my first response would be, as well, I would say that the public involvement in research is health workforce, it's healthcare workers, but that doesn't seem to float with panels. They go, no, try again, and then we would make kind of the suggestion that, well, because it's about the health system, maybe everybody, anyone in the public is a potential user of the health system. So could we just ask people in the general public, and we get no, wrong, try again. So it's quite frustrating to kind of try to work out what's the right answer when it comes to PPI if what you do is more workforce than health care and a specific type of care.
Yeah, thanks, Jennifer. I understand your frustration. I guess I was surprised that you're being told it's the wrong answer. I don't think that there should necessarily be a wrong answer to how you're doing things. But I mean, I would think that is the correct approach. It is the public, but it is also the people who are working would be your PPI group or your target group. So both people who are going to use the system, but the healthcare workers that are I guess leading in the system. So that's the first thing I would say. The group of people that you'll be looking for is both. And then it's really, like I said, looking at the research cycling and where it makes sense to bring it into your work. I think, and how you're doing things, particularly the design of what you're doing. I mean, it'd be really useful to bring in that the healthcare workers into that. What you're looking at, is it relevant for them? Is it actually a problem for them? Whatever the question may be. And then right through. So I mean, I do think you could bring it in, but I think you're right. I think it is the public, and it is both the actual workers themselves.
Thank you. So just making a stronger case, going, well, hang on, no, we
Yeah,
are
as to why. Yeah, as to why they are the suitable.
Okay.
You know, a representative group of healthcare workers.
Thank you.
Thanks, Jennifer. Does anyone else have a question or? And yeah, hi,
Dylan
Dylan
has his hand up.
Yeah, how are you? So we work with a PPI group. I'm just wondering, in terms of, because a lot of them are doing it on a volunteer basis, do you set out expectations in terms of how many times, let's say, you contact them or follow up with them, trying to get to them to engage with whatever project you're working on or whatever component of the project you want them to be involved in? Are there certain guidelines that you should follow in terms of not, I suppose, badgering them because they're volunteer and you don't want to, you know, push it too much and disengage them with being a PPI representative?
Yeah, I mean, the HRB, we wouldn't have guidelines. I mean, what we would want people to be compensated for their time, and we do encourage that and allow it within our award budgets. So that's one thing. But in terms of how often you contact them, that is something that I would advise that you ask. I mean, what is acceptable for the project, and for if it's a patient group, or you know, whatever the case may be, but what's acceptable to them and what's realistic. I think that's really what's important in this. It's getting that balance right in both sides, and what's, I guess, needed for the project, but what's realistic in terms of people's time.
Okay.
And then just really, just really in bearing in mind that they're giving their time, and how could you make things easier for them.
Exactly. Yeah. Thank you.
Aoife, there's a question in the chat box. I'll just read that out. From Kate, what is an ideal PPI format from the HRB perspective involving public and patients in study design, steering committees, organising public meetings, i.e. conferences for the public, asking for reviews of any dissemination, etc. And can you recall a good PPI example and tell us about it?
Oh God, there's a lot in there to digest. Let me have a little look over this.
Break it into two, perhaps.
What is the ideal? I mean, again, I think it's whatever suits the project and where can you bring that in. I mean, in an ideal world, what would be lovely is for your project if you had a PPI panel that you could, you know, go to. But I mean, obviously, that would need to be set up wherever you are, so it's not that easy. But if you were working in an area, a particular disease area, and you could link in with a charity, and there was some way of reaching a PPI panel for the different aspects of your research, I mean, that would be the ideal. But that's not always going to be feasible. Ideally, it's making sure if it is a new grant that you're bringing that, you're including it as part of the grant, including it in the budget. But what, again, as I keep saying, what makes sense to the project, we do recognize that everybody's at a different stage in their PPI journey. So it's not, you know, it's not an expectation that you're going to be bringing PPI into everything. A good PPI example, we do have a few cases, we have started putting case studies up on our website. So it would be worth taking a look at that. I'm trying to think now. There was a study related to the MAMI study, which was looking at women following having their first child. But what was really good about this one, and it ended up creating a toolbox for women afterwards that they could go to, was they brought their PPI contributors were involved in every step of the way in designing this toolbox. And then they continued with any dissemination they did, they would always disseminate with their the PPI contributors. So I think that is oh, and I can see Martha said the D1 Young panel. It's a brilliant example. I'm tried not to use that example, Martha, because I know they presented today, but it is a really fantastic example, I have to say. But I try not to go back to it all the time. But I think that like bringing your PPI contributors along throughout the whole process, and then particularly at dissemination, it can be really impactful having the contributors disseminate with you. But I hope I answered that. It was a very detailed question.
Claire has shared a link in the chat box for anyone who's interested to go straight to the PPI story.
Yeah, and we're trying to put more case studies up. We're collecting them as we go. So that's something that we'd like to expand on, just having, you know, nice examples up there for people to look at. At the moment, we're not measuring the impact of PPI in our projects. We wouldn't be at that stage yet. There is some UK guidelines about there's UK standards. We don't that you could look at, and we can share a link afterwards. We haven't moved to that in that direction yet in Ireland, having standards as such. Looking at the impact of PPI, it is something that the PPI network are planning to do, which has just launched in March. So we will have PPI Ignite offices in 7 universities in Ireland, and that are helping increase capacity of PPI. And one of the things they will be looking at is measuring that impact of PPI. But as of yet, it's not something that we're doing in our grants. Laura, do you have a question?
Yeah. Hi, everyone. I kind of have 2 questions, maybe jumping off the conversation and particularly what Dylan said earlier. So one would be that a bit more specific, whether you think that maybe the HRB might adopt or create some guidance to be used when integrating PPI into research projects, at the grant stage. And then more broadly, I suppose, I'm just interested in like lessons learned from a couple of years of integrating PPI into research in a more structured way. If people have, particularly, I've just started a role that will be heavily involved in PPI, and I'm interested in some of the practical challenges that maybe weren't evident going into it.
Mm-hmm. Sorry, what was the first part of your question again? Sorry, I'm thinking the second part.
Yeah, no problem. The first question just around whether the HRB are maybe looking at incorporating guidance or guidelines into planning for PPI involvement.
Yeah, I mean, we've done a few things. So we're funding the PPI network. So to improve the quality, what we have done is these offices are being set up. There was 5 offices previously, and now it has moved to the network. So there will be offices that researchers can go to in their host institution to advise. The network is also tasked with training people, so that there will be training available for researchers. So that's I guess HRB are funding that indirectly. We also do, we also are going out and talking to people, taking part in conferences, any invitations that we do get, we accept and we go out. But it is something that we're going to look at. We did recently do a survey. We're still analysing the results and what people want, and that is something that came out really strongly about further guidance. So it is something that we need to think about more. To be honest, what else can we be doing? But as I said, we are funding that PPI network, and the aim of that is to build capacity, and there should be training available for people, and support and direction. And then lessons learned. Are you linked in with the HRCI, the Health Research Ireland? You are you?
Yes. So
So there's obviously
yes,
they have their shared learning group for anyone who's not familiar. So anyone who's linked with the charities can take part in the shared learning group that HRCI have. So that would be one way to I guess reach lessons learned and see what has worked for people and what hasn't worked. But it wouldn't at a HRB level, looking at lessons learned, it's not something that we'd be doing at the minute. I think
I've just thought I'd throw it out there if anyone has anything.
And it maybe I'd say Martha's here with us. I don't know if there you may know something about.
Yeah, so I think in terms of lessons learned, and it was really echoed something that Emer Marcy said earlier as well, the D1 Now program manager is just a good quality PPI. It takes time and it takes respect, and it's about what, as Sean said, we're service experts, not experts by experience, something like that in his presentation, just to be open to change and to dedicate some time to your PPI. Like as researchers, we have our outputs, we dedicate time to publications and to the methodologies we use. And this is just another aspect of research now that improves our research that we need to be dedicating time to as well. You know, it's that the 2020, what they were speaking about earlier. So time, and then to be open to change and open to the comments from your PPI group, and to be open in terms of that there is a level of decision making there for them, and to be open with who you're working with on what can and can't be changed. Because realistically, if you have funding for a specific research question, there's no point speaking to people about, you know, changing the research question or like the disease area you're looking at. Like that's not possible. So that just really is a waste of time of their precious time. So just to be open about the decision making level there, and to try and keep that transparent and respectful. Would be my 2 pence there.
No, that's really useful.
Aoife, sorry, there's one question from Anne who asks, as an early career researcher new to PPI, would you recommend linking in with research groups with established PPI to learn what good looks like?
Yes, is the short answer, definitely. Again, in that survey that we've recently launched, we did ask where people are getting their PPI support from, and it did come out really strongly. It was from peers and people who are doing it well, or have been doing it for a while. So I think that it could be really useful to talk to peers who are already doing it.
And there's one more question, Aoife, from Jennifer. Does the HRB, like comparable international funders, have a set of standards for PPI participant remuneration and costing?
We don't. Our advice is to work with your host institution on the costing. I know there is a lot of work at the moment going on in the system around costing and paying PPI contributors, because it is an issue depending on where you are. But we don't. So it is really something to look at with your finance office at the local level. So I think we've a minute left if anyone else had any other burning questions. No. Okay. Well, thank you to everybody. It's great to see, lovely to see the interest on PPI, especially at this stage of your careers. It's when to get started. So thanks so much.
Thank you, everybody.